In this video, the ultrasound assessment of the inguinal-femoral lymph nodes will be shown. The patient lays in supine position, with the legs extended and apart. The femoral triangle is delineated by the inguinal ligament superiorly, the medial edge of the sartorius muscle laterally, and the lateral border of the adductor longus muscle medially. The apex of the triangle corresponds to the intersection of the sartorius and adductor longus muscles. The probe is positioned at the apex of the femoral triangle in the transverse plane and moved cranially along the femoral vessels up to the inguinal ligament. The probe is then rotated in the oblique plane to obtain a longitudinal view of the vessels. On ultrasound, the first landmark is the valley or V sign that is formed by the intersection of the sartorius and adductor longus muscles. Moving upwards in the transverse plane, reaching the center of the triangle at the saphenofemoral junction, the second landmark is visualized, the snail sign. The head of the snail is composed of the transverse section of the great saphenous vein, its tributary veins from the horns, and the common femoral vein forms the body and the tail, while the shell is composed of the femoral artery. On color Doppler assessment, we can identify the three major tributaries of the great saphenous vein. Moving the probe upwards and maintaining transverse view, we reach the inguinal ligament. To better recognize the transition between femoral and external iliac arteries, the geisha sign can be used. This is represented by two coaxial branches of the external iliac artery, namely the deep circumflex iliac artery and deep inferior epigastric artery. We can follow the deep inferior epigastric artery ascending in the rectus sheath posterior to the rectus abdominis muscle towards the umbilicus. Coming back to the snail sign, we rotate the probe in oblique view to obtain a longitudinal scan of both femoral and external iliac vessels. In this scan, we present the hill sign, marking the transition between femoral and external iliac vessels, with the inguinal ligament above them. To divide the inguinal-femoral lymph nodes according to the decilar regions, two perpendicular lines are drawn at the level of the saphenofemoral junction. In this case, normal lymph nodes are visualized.